And to talk more about COVID-19 in Kentucky, we have a special guest today that you will certainly recognize if you have been watching the governor's news conferences over the past few months.
Of course, Kentucky's Public Health Commissioner, Dr. Mustack. He joins us today via Zoom. Commissioner, we appreciate you taking time out of your very busy schedule to speak with us this afternoon.
Hi, Dee and Chris. Thank you.
All right, Dr. Stack, as we just mentioned, for the third day, our positivity rate has been under 4%, yet the daily numbers of new cases continue to hover in the high 700s. Is this lower positivity number more important than daily totals and something good that we can hold on to?
Well, it's a good sign that it means we're testing enough at the moment. So if the number of cases are staying stable or increasing, but the positivity rate is going down, it means we're testing a sufficient number of people. Some guidance would be to try to keep the positivity rate under 3%, which would mean you are identifying positive cases quickly enough to hopefully contact trace soon enough to try to minimize the spread of disease. So it's a good thing, and it actually is compatible.
Doctor, let's talk about the hope for a new vaccine. As you are aware, there are a number of biotech companies that have had some promising results on a vaccine. The president insists a vaccine will arrive soon, but the top vaccine makers have a far more cautious timeline. What is your realistic assessment on when a vaccine may be distributed?
Second or third quarter next year for most people. So you're looking probably around summertime for the average person. There may be small quantities of vaccine available to targeted or higher risk populations, perhaps in later December or beginning in January, but the average person not till summer next year.
All right, Doctor, we're hearing this term thrown around, herd immunity. What exactly is it, and will the process be a result of more people getting and recovering from COVID-19, or when there is a mass vaccine available?
Right, so the concept is that if enough people are immune to a disease, then it won't spread between folks, because if I have the infection and you two already are immune, you won't be able to get infected and you won't transmit it. There's two different ways to get herd immunity. One is naturally, meaning people get the infection and recover from it. The other is with the vaccine. Natural herd immunity is not a realistic opportunity for the country. At a 1% mortality rate, that would mean 3.3 million Americans have to die to get natural herd immunity if they were all to get infected. We need at least 70% of people to be infected and recover in order to have sufficient herd immunity, we think. 70% is the yardstick. That would mean that's that ballpark around 2 million Americans, so you don't quite get to the 3.3 million. Vaccination is the way you get immunity without having to accept death along the way. So we need vaccines. We need the vaccines to work. That's how we get to an immunity that's sufficient to protect us all.
Gotcha. Doctor, I did want to ask you about this. The governor was asked at a recent news conference about Halloween this year. He says he is still thinking it through. What advice do you have for parents who would like to take their kids trick-or-treating next month?
Well, we know how important this is, and we're going to look for every opportunity as safely as possible to allow kids to have a good and a safe Halloween. I think that interior events, so doing indoor events like maybe going office to office or trick-or-treat at the workplace, I think people probably should not expect that to happen because those are higher risk. We're waiting on guidance from the Centers for Disease Control, where we'll try to be as consistent as possible across the different levels of government. And so hopefully there are ways to do safe outdoor activities, and I'll certainly look for every possibility to do trick-or-treat if we think we can do it safely. Hopefully we'll have the guidance soon.
Dr. Stack, we know the governor is not giving a formal guidance on school reopening and scheduling, but we are seeing the University of Kentucky looking ahead and planning for the spring semester starting a little later to allow more time for everyone to recover and come back to school, not having spring break to keep traveling to hot spots at a minimum. Would this be a plan you would like to see other colleges and universities in the Commonwealth as well as K-12 districts look at modeling?
I've had wonderful discussions with K-12 superintendents, the Kentucky Department for Education, and the presidents of the colleges and universities, both public and private. I think what has distinguished the vast majority of these communications is everyone's trying to do the right thing and everyone's trying to do the best they can. So I think UK and the other universities and colleges, I applaud them for their efforts. I'm in dialogue with them, and I'm happy to continue to work with them. I do think minimizing travel, minimizing interactions between each other, and taking aggressive steps to make sure you identify sick folks and get them tested quickly and isolate and quarantine are really important, and a number of colleges and universities are doing those things. So I'm very grateful for that.
One more question for you, Doctor. A little bit of levity for such a heavy topic that we've been talking about. But it is a big deal, sir, when you have an ice cream that's named in your honor. Now, it seems to me, I remember having a conversation with your wife back in May when Lexington's very own Crank and Boom named the flavor Dr. Mustack in your honor. What did you think of that flavor? What did you think about the honor?
I like it. I like Mustack ice cream. And of course, getting on the front of an ice cream container was a distinction and an honor I never expected along the journey when I became a health commissioner. So thank you to Crank and Boom. And I supported local business. We bought numerous quarts or pints, so I think it were pints. We bought numerous pints of Dr. Mustack ice cream. So thank you to them, and thanks to all those who supported local Kentucky business along the way.
Well, I'll have you know that my little daughter, Rainier, is a big fan of it as well. Dr. Stack, thank you.
She loves it.
Thank you.
All right, Doctor, we appreciate it.